cette présentation très, très intéressante. Nous allons garder les questions pour la session. Merci.
We'll move to our next speaker. This is, I have the pleasure to present Dr. Julien Picard. He's a professor of anesthesiology and critical care medicine at Grenoble-Alpes University. He has a clinical activity in trauma ICU and emergency involved in the French Society of Anesthesiology and Critical Care. He contributes to the European Society of Anesthesiology and Intensive Care as a member of the Simulation Committee. He is also a member of the Board of Scientific Committee of the French-speaking Society of Simulation and Health. He is also a member of the editorial board of the American Patient Safety Foundation. Dr. Julien is going to talk with us about hot debriefing from simulation to real life. The floor is yours, Dr. Julien.
So thank you very much for this invitation. We will now start dealing with hot debriefing from simulation to real life. What is important to me is to show you how some techniques that we use in simulation can be moved to the real life. And that is a way to close the circle, because I think that simulation is a perfect tool to try to learn some new things. But the aim is finally to use what we learned in simulation in the real life. These are my links of interest with that topic, as I'm the president of the Patient Safety Committee of the French Society of Anesthesiology and involved in simulation and patient safety both in France and Europe. What is the definition of the debriefing? So the debriefing is originally a practice that comes from the militaries and that is useful after returning from a mission. The aim of the debriefing is to reduce the incidence of post-traumatic stress and is a way to try to manage it. It's a method based on the group cohesion and empathy, and it's supposed to help to accelerate the recovery for the militaries who have been exposed to several stresses and are suffering from post-traumatic stress. When we are doing simulation, there is some rules and agreements that we all share and that are really important and mandatory to reach the aims we want to reach in simulation. The first of all is to provide a safe environment. Safe for the patients, of course, because when we're doing simulation, there is no real patients, but also safe for the participants, because when you are exposed to all your colleagues that are looking to what you are doing in simulation, you are taking risks. The second rule is really a basic principle of non-judgmental. We want people to discuss during the debriefing a reaction, an attitude, a decision maybe, but never a person. And it's also a deal with what we call the good judgment attitude, meaning that we are creating a context for learning and change. We are dealing with meanings and assumptions, and those meanings and assumptions can come both from the instructor or the trainees. There is no truth, but different perspectives, different ways to see a problem. But we are all sharing the same objective, that is to learn and to change and to make our practices better. The third rule in simulation is what we call the fiction agreement, meaning that we try to reproduce a realistic environment, but we cannot always reproduce an environment that looks exactly like the place where people is working every day. But we all have to agree on the fiction, considering that what we are going to do is related to the reality and looks like in the everyday life. The last agreement is what we call the confidentiality agreement. We always explain to the different participants that we will not share with other persons what we will be seeing during the simulation session. And we ask them in return to do not share with other persons the content of the scenarios. So those 4 rules are the main rules and agreements in simulation. And we'll see that we can move them to the real life. Why the debriefing can be useful in the real life? So it may have several potential benefits. It has been shown to improve the morale of the staff. It can improve the cohesion of the teams. It can also improve the care for future patients. And it's a way fostering a culture of learning, patient safety, and quality improvement. In the literature, and I'm now sharing with you a paper from the Current Opinion in Anesthesiology, that the debriefing after a resuscitation in the real life can provide to the clinicians or the teams feedbacks on their own performance in a resuscitation. It can provide team feedback. It can also be used to describe the situation, but in the literature and in that paper that I'm showing you, the optimal method remains unclear, and most of the published studies report improvements in performance during resuscitation and after resuscitation debriefing. Here are the data that I was telling you, the general topic. They try to compare different strategies for the way to deliver hot or cold debriefing. Hot debriefing is providing the debriefing immediately after the situation, while cold debriefing is supposed to be a debriefing that is done a couple of days, maybe weeks after the situation we want to debrief. So they try to detail how hot and cold debriefing can be different in their format, staff dedicated to, or data included in the debriefing. And here in that figure, we have examples of objective debriefing data based on, in that example, defibrillator downloads. They use the data that has been recorded objectively to do the debriefing. And in that example, they can try to understand why and when they were efficient or not, and how they can try to improve their performance for the next patient, for example. In that paper, they used a qualitative method to compare and measure the impact of hot debriefing after, in particular, critical situations. They say that the rationale for that is burnout and compassion fatigue are increasing in terms of prevalence among emergency physicians. And they produce a qualitative research approach using interviews, semi-structured interviews, to explore the participants' view regarding the debriefing and that follow-up initiative. The major findings in that study were about the themes that were discussed, the way the discussion was run on, and the more broader implications. The major findings about the themes were that they discussed about understanding and about the perception of the follow-up, about the barriers and their neighbors, and about the perceived benefits of the follow-up. Several ways could be, the discussion could be run in several ways, with formal or informal modes, with hypothetical ways to introduce the themes that were discussed, but also integrating personal experiences. And the perceived benefits, that is for me the main message of that study, were that the debriefing helped to improve the quality, improve the culture in the workplace, and established connections between the patients and the continuity of care, and finally helped to clarify several thematics and several critical situations that were discussed during the debriefings. So the broad implications were a positive impact on the workplace cultures and several implications for both leadership and nursing management. When we look to the rules I described to you and for simulation, we see that those rules can exactly be exported to the real life accepted the fiction agreement that doesn't no mean in real life context, but both safe environment, non-judgmental attitude, and confidentiality agreement are the three rules that are necessary to provide a proper debriefing in the real life. When does the debriefing has to be organized? In that study, they compared the effects and the impact of hot and cold debriefing, meaning immediate or delayed debriefing in simulation. And they showed that the impact on both knowledge, attitudes, communication, patient safety culture, and attitude to team working had impacts when doing a debriefing, but that impact was higher when the debriefing was done immediately. Here is a hot debriefing, here is cold debriefing, and they all have impact, but the impact is higher when the debriefing is done immediately after the critical situation. They also look at the satisfaction of the participants of the simulation and of the debriefing, and the levels of satisfaction were higher, you can see them here, in the group where the debriefing was done immediately after the simulation than in the group where the debriefing was done later. We can imagine that that satisfaction can be the same in the real life. And the next question is, for whom can that hot debriefing be done? In that work, they describe how in real life, hot debriefings can be a way to improve quality, improve collaboration. And the context in which they developed it is after in-hospital cardiac arrest in an international pediatric hospital. That means that it's a perfect example of critical situations. I mean, cardiac arrest in pediatrics is really one of the more stressful situations that we can imagine. So they described the way they did the debriefings. Here we have comparison of two groups. One group where the hot debriefing was not performed, and a group where the hot debrief was performed. And they compared the situations, showing that the kind of situations were the same, and they discussed about the kind of patients, the categories, the parameters, and the ways the patients were included, and the parameters they're recorded were the kind of illness category, the location, if it was in the emergency department, in post-interventional ICUs, etc., and the time of the day of the arrest, if it was during the day or during the night. They also looked at the day of the week. So the answer to that question, for whom may the debriefings, and especially the hot debriefings, be provided, the answer is easy: for everyone, for all those who participated to the critical situation. If now we discuss of what may interest you the most is the way we can do that debriefing. People who used to manage debriefings in simulation are necessarily more capable to provide debriefings in real life. But what we will see is that many people can manage a debriefing in the real life despite having no special pedagogical competencies, if they remain aware of a couple of things. So how to do that debriefing? As in simulation, the way to conduct a successful debriefing is to prepare it all well in advance. I mean that a successful welcome and a successful briefing is really the key of the success of the debriefing, and that's true in simulation context, but it's also absolutely true in real life context. That means the way you will propose that hot debriefing to your teams is absolutely the cornerstone of the success of your debriefing, hot debriefing. And you will certainly have to explain prior to starting the first hot debriefing to your team how that will be run, who will do the debriefing, at what moment, in what situation. And I will take a couple of minutes to describe it to you in detail. When we want to promote hot debriefing, we can look to that example of promotion of hot debriefings in an emergency department. In that study, they provided simulated cardiac arrest scenarios, and they asked to all their personals through a form that they could fill in their opinion about the debriefings and about the cardiac arrest situations. The study lasted 6 months, and 42% of all the cardiac arrest cases underwent hot debriefings. After that, practical changes were introduced in the equipment of the resuscitation room regarding non-technical and technical and knowledge of the service professionals. I mean, all the competencies. And 95% of the participants felt that the tool, hot debriefing, helped them in their clinical practice, and 9 of 10 of them felt that they benefited psychologically from the process. So psychological positive impact and performance clinical positive impact too. That's a way to do the hot debriefing, and I will show 2 or 3 different ways to do it, and I will finish with the way we do it in my hospital in Grenoble in France. This is a way to do what they call the top 5 hot debriefing. This model has been designed initially for resuscitation cases in the emergency department. And this acronym STOP is for summarize, things that went well, opportunities to improve, and points to action and responsibilities. Summarize things, opportunities, and points. And following these 4 steps, they go through the hot debriefing in that context. They remind that it should start with thanking the full team and asking if everyone is okay. Usually when we are performing a debriefing in simulation, we used to divide it in 3 parts. The first one is the emotional impact. The second one is the objective description of what happened. And the third part is the analysis and conclusion. So in the real life, the debriefing will absolutely follow the same 3 steps: emotions, objective description, and analysis and conclusion. So after asking if everyone is okay, if the answers are yes, we continue and we follow the 5 steps. In that model, they only take 5 minutes to do that debriefing, meaning that the lack of time is not a way to avoid doing hot debriefings. They remind us that the purpose is to improve quality of patient care, and it is absolutely not a blaming session, and that may have connections with the 3 rules I described to you in introduction, explaining that the participation of everyone is welcome but not mandatory, compulsory, and that all information discussed during the debrief is confidential. So you see the 3 rules, okay? Confidentiality, not blaming session, I mean not judgmental, it's the same, and creating a safe environment, asking if everyone is okay, is exactly what I described to you as we do it in simulation context. They use then a kind of form to complete the summary of the case, the things that went well, the opportunities to improve, and the points to action responsibilities. And that's also as an echo of what we do in simulation-based debriefings with the technique of debriefing that we call Delta Plus. Delta Plus, Delta as the Greek letter, meaning that is what we can improve, Delta. and the plus is that what is positive, what went well, okay? So it's really the same way that we do it in simulation context. And I can show you other ways to do it. In particular, in that study, I will show you, sorry, the graphics showing the confidence of the debriefers depending of the role they were taking during the debriefing. In light blue, we see people who is very unconfident. In dark blue, those who were confident, and in the orange and yellow, those who were confident or very confident. And we see that leading the debriefing is not easy, as those who did it felt unconfident or very confident, while just contributing to the debriefing is easier, and people feel more confident in that role. That means that the repetition of the roles should be done relatively to the experience of the different participants, and maybe relatively to the experience in debriefing simulation sessions. Those who has the opportunity to run simulation-based debriefings probably will feel more confident than those who haven't done it before. So I should advise you to start organizing hot debriefings that are led by people who used to do debriefings yet in simulation context. And time after time, probably everyone in your department will be able to lead a debriefing, but they will need to be contributing as simple contributors for the first times they participate. And here we have examples of issues that has been identified during that stop 5 hot debriefings, and of interventions that have been performed after that hot debriefing, showing how hot debriefings can help to identify issues and to correct them. As you can see in the last column, the issues didn't repeat after the intervention after the debriefing. So hot debriefings help to identify situations, to provide intervention that can correct them and to avoid their recurrence. This diapositive is only to show, this slide is only to show you that even the American Heart Association recommended to provide debriefings after a time resuscitation, and that those debriefings are really related to improved quality of care, improved collaboration between healthcare professionals, and they show us the tool they use in that hot debriefing situation that is really close to the one I showed you before. These are the kind of themes that were discussed, and you see that most of them are non-technical issues like communication, leadership, situational awareness, and are related to patients, family too, and few of them are related to technical or equipment-related issues, finally. Here's another paper showing how promoting hot debriefing can be valuable in an emergency department. And this is another way to provide hot debriefings. The technique is exactly the same or really near to the stop 5. It's called differently stock, but you see that they summarize, talk about things went well, talk about opportunities, and they only add the question if a cold debrief is necessary after the hot one. And I will finish with that recommendation that comes from guidelines that we wrote with several colleagues past year about human factors in critical situations. And you can also look to those recommendations, those guidelines that are in open access in the French Society of Anesthesiology, SFAR, internet site, and that are both available in French and in English. So between those human factors, we detailed recommendations about the debriefing, and we particularly developed all the literature related to how hot debriefing can provide improved situational awareness, improved team cohesion, improved communication, and reduce the impact on the professionals as burnout, fatigue, etc. My last slides will be in French because I wanted to show you how we perform the hot debriefing in our emergency department, déchocage, in the Grenoble's University Hospital. This is the form we use to complete the different steps I described to you before. And these are a couple of points detailing some vocabulary differences, explaining the difference between hot debriefing that takes place immediately after the critical situation, which aims is really to identify issues, to give opportunities of learning, to reduce emotional impact, while cold debriefing happens later and is a way to make observations and discuss how we can change things to improve quality too. And with both debriefings, hot and cold, are different of morbid mortality reviews, which are collective analyses, retrospective, systemic, and really different, showing a different methodology and having no deal with the emotional impacts. Okay, so these are different things. Here we have a summary of for whom, why, when, where. And I would just take 2 minutes to describe where to do the debriefing. It may take place at a very near place to the workplace because we will spend a short time to do it. And we have no time to go to a far away dedicated place. But it can be interesting to have a kind of dedicated, I mean, for example, a place where people take their pauses or where they take the coffee. But we have to respect confidentiality and to avoid other people that have not been involved in the critical situation to be there at the moment of the hot debriefing. This is a summary of how we do it. All that is included in our procedure. And here is our acronym to remind that we need availability, disponibilité. We need to explain the situation, to ask if all went well, to ask for the feeling, the emotion, as I told you, to identify the ways to improve situations, discuss about a gunnery material, and finally discuss the need for a cold debriefing. And we developed further a kind of taxonomy of critical events to help to categorize them and to make the hot debriefing faster after that. The last part of our procedure is made of tips for successful debriefings, expressing emotions at the first person, I felt, I had the impression, etc., and explaining how things happen at the plural, saying we did that, we could have done that, trying to share the time so that everyone can speak, and explaining that a negative issue has to be balanced with a positive things that have been done. It's exactly what I described you before as the Delta Plus before. So as a summary, and this will be my conclusions, hot debriefing is coming from a military background on return from a mission. It has been firstly designed to reduce post-traumatic stress, to manage it, and to improve group cohesion and empathy. The objectives are to accelerate the recovery and to improve safety and quality of care. There are several ways to do a debriefing, and the literature does not provide high-level evidences of one way to do it. but it seems advisable to carry out a debriefing in critical situations and to do it immediately after the situation, hot debriefing. That's why when, to the question when the response is immediately after, all the members of the team that has been involved in the critical situation should be included in the hot debriefing. The numerous modalities, self-debriefing, debriefing with a trainer has not been showing in the literature differences in terms of impact. You should use the technique that you master. And finally, one of the important points is the acceptability and the training to do that. And my main advice should be to do it in simulation first, and then to do it in the real life. Thank you very much.